Look at me. You see me? Okay, sip your juice.
It's okay.
Sip your juice. Okay. Sip.
Charli D'Amelio is the biggest star on TikTok. With over 80 million followers, she is an icon in social media. And she recently underwent surgery on her nose. Let's react to the truth behind her nose surgery.
My friend and I hit head to head and we both broke our noses. And they didn't do much for the broken nose because they didn't see it as much of a problem at the time, but over time and with another break in the middle of then and now, it's gotten a lot worse. It does bleed quite often, so that's been something very difficult for me, and since I can't breathe, I can't dance.
When a person breaks their nose and the nose becomes displaced or moved out of place, then you have two opportunities to fix it. It can be repaired, basically doing what we call a closed reduction, where if the nose is bent over to the side, a patient is put under anesthesia, usually within a few days of the accident, and the nose is broken back into place and then a splint placed back on it. The second opportunity to fix up a broken nose is after it has completely healed via a nose job. Now in this instance, Charli is seeing Dr. Raj Kanodia, and he is a true legend in the field of cosmetic rhinoplasty. He was on a show many, many years ago called Dr. 90210, which was my first TV appearance as well.
Okay, so we just finished our consultation and he basically said that I have a lot of problems and my nose is still broken and so is the septum's all messed up. I realized I have a lot more problems than I thought I did. So it's super cool.
There are nasal bones that are basically the bones on the outside that can break, and those are the ones that we think about most when we think about a broken nose. But there's also the septum. The septum is composed of cartilage, and that's the part that's right between the two nasal bones that separate the two nasal airways.
And that's where you see the septum is broken. You see, instead of being straight, it goes there and comes back like it creates a V. And that's what we need to fix. That's why. Like I'm pulling, and look how she's blocked, you know. She's got there. Wow. Look at how small slit. That's all she has. So all that septum, which is broken to the right, we have to push it. But again, see, this is a very good view for your camera to see how broken it is.
The septum should be straight down the middle of a nose. So if your nose is a triangle, it is a line coming straight down the middle. Well, what's happened to Charli, it sounds like, is that septum has really fractured over to one side, almost making that straight line into a V. And that has closed off the airway, making it very difficult for her to breathe through half her nose and to dance like she wants to.
Hey guys, it's Charli, and I'm about to get my blood work done so I can get my nose surgery.
Almost done. I'm very lightheaded. Oh, no worries. You guys give her some orange juice. Who's got orange juice or something? Put your finger there. Firm pressure. Got it? Okay. Alright, so we're going to put this plate.
Just breathe.
And then do me a favor and breathe this. Take a deep breath. Blow out slow. Take another deep breath. Look at me. You see me? Okay, sip your juice.
It's okay.
Sip your juice. Okay. Sip your juice.
Sit on the floor, please.
Lay down. You can lay down. You were holding your breath. Lay right there on the floor. Lay right there. Head back and then just relax while I put your label on you too. And then just have her smell the alcohol. She just needs to breathe.
Passing out and getting lightheaded during a blood draw is super, super common. And we see it in my office all the time when people get Botox and filler. I have patients that literally pass out when I'm marking them for surgery, where we haven't done anything to them, but literally marking them for surgery and they pass out. The first thing that you do, if you are doing something like this and you're starting to see stars, you're starting to see kind of that staticky screen, you gotta lie on the ground and put your feet up.
So I just got out of the hyperbaric chamber and it was not that bad at all really. I didn't mind it, and I think I'm going again after the surgery just to make sure that everything's healing properly.
A hyperbaric oxygen chamber is a chamber that you can see Charli lying in where they surround your body with high levels of oxygen. And the idea is that if you can infuse a ton of oxygen into your tissues, it may help you heal better after a surgery. Now, I typically don't use this before surgery, but if I have a patient who after surgery isn't healing very well, occasionally we'll send them to hyperbaric oxygen to see if we can get their wounds to heal quicker. It's also used very commonly in people who have chronic wounds, like diabetic foot ulcers, and other types of sores that can benefit from that high intensity oxygen being infused into their tissues. This episode is brought to you by my skincare line, YOUN Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
Due to the injury, she had this bump because the two bones widened, and you can see the width of the bone right there, and it hurts where the bones were splayed out. So it's not cosmetic as such, it's mostly to fix and bring the anatomy back to its original shape. So the two bones will be narrowed, this bump will be filed, and the most important thing is the septum is twisted to the right and then left. We need to fix the septum so she can breathe better and she can dance better.
So it looks like the nasal fracture caused her nose to actually widen a little bit and to create a little bump on the surface. And I think that the minor change in shape of her nose that it looks like he may give her here is probably going to be considered not a big deal compared to the huge improvement I hope that she gets in her breathing so that she can go back to doing the dancing the way that she wants to.
All the way in the back, fortunately, I was able to find this piece of septal cartilage which was obstructing her airway, and I'm going to carve that and create spidergraft to open up her valves.
Okay, so what's going on here? So he removed a portion of her septum, and then what he's most likely going to do is convert that, basically cut it into what are called spreader grafts. Spreader grafts are little pieces of cartilage that go on either side of the septum to allow the nose to open up a bit. When people have problems breathing, it's that part of the triangle of your nose that can basically drop down. And by putting a spreader graft in, it can spread things out a little bit, allowing the airway to open up for her.
So I have a feeling that the injury she had is what must have created some sort of a septal hematoma, and that just ate up most of the cartilage.
When somebody breaks their nose, the first thing we look at is the septum to make sure that the patient doesn't have a septal hematoma. And that is a blood collection in the septum, kind of underneath the mucosa and next to the cartilage, that if that blood collection is not drained, it can actually cause the cartilage to die off.
Wow, this is the broken piece of bone. This is where it was sitting. It was sitting right there, and that was the bump.
Now, I don't know about you, but I find this so satisfying that Dr. Kanodia was able to remove that chip of bone that created that bump in Charli's nose, and now it's going to be nice and straight.
After I've removed this piece of bone, I will just smoothen the bone by using, it's like a nail file, and it's just going to smoothen it. So it goes inside the nostril and it just smoothens all the rough edges.
This instrument is called a bony nasal rasp, and essentially it's a nail file. And in a situation like this where Charli had that kind of chip, that spicula bone that was causing a bump, you can remove that and then use the file to really smooth out the edges to give her a nice, smoother nose You may or may not be able to see it, but you definitely will feel it.
Wow, that's a beautiful profile. Restored back to its normal anatomy. That little bump due to the fracture is gone. So now it's restored back to its normal anatomy.
Studies show that literally 1 millimeter of unevenness of the nose can be seen at a normal speaking distance of about 3 feet away. So whenever we do nose jobs, we're always making sure that it looks and feels completely smooth. Now the nose does swell quite a bit during the operation, and so that's why surgeons like Dr. Kanodia and myself are very, very meticulous in doing the operation and looking at it literally hundreds of times before the surgery is done to make sure that it is a perfect result. And I think Charli here looks perfect.
Oh, Charli, I'm so happy.
That's what a tissue is. For Big C.
Got all your medicine.
Look at that smile. Oh my God, I love that smile.
Well, huge props to Charli and her parents for sharing her story of her nose surgery. It's a breath of fresh air that certain celebrities are so open when they have surgeries like this, especially plastic surgeries. Well, if you enjoyed this video, there's so many other reaction videos. Please subscribe to my channel and remember to eat real food, use clean skincare, and always consider actual plastic surgery as a last resort.